Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population. Today, we are joined by Dr. Kayla Blakely, Assistant Professor and the Coordinator for the Adult Gerontology Primary Care NP Specialty Track at the University of Alabama at Birmingham School of Nursing. She will be discussing how the COVID-19 pandemic is affecting rural healthcare practices, including considerations and unique challenges in caring for the South's patient population, as well as telemedicine's role and the way care is being delivered. Dr. Blakely will also provide insight into how this crisis has permanently changed rural health. But before we begin, I would like to encourage our listeners to visit sma.org/podcast to subscribe to the Southern Medicine podcast, as well as other SMA podcasts. Dr. Blakely, thank you for joining us today.
Thank you. I'm happy to be here.
We are seeing that this pandemic is affecting every aspect of our life, no matter what piece of the landscape that is. And it is forcing large hospitals and clinics to close and to change the way they deliver care. How is COVID-19 affecting the rural practices and facilities, which already experience more limited resources and staffing?
So with COVID-19, it seems the rural areas are they are more sparsely populated as far as the availability of resources and also just their location to the urban areas. It's a little bit more of a challenge to come into the urban areas to seek out medical care. And one thing that we're seeing is a lot of the smaller communities and rural areas, the clinics, they have received some help with the insurance companies to be able to do telemedicine, and for those offices to be able to receive reimbursement for that telemedicine. And the challenge of it is having the telemedicine or telehealth availability, and also having some type of service available for those who are uninsured or underinsured to be able to seek out that telehealth service if needed.
So telehealth, we are seeing that is an option at this time. And what do you see as the benefits and the effectiveness? Obviously, there is a benefit of being able to provide care for those who perhaps would not otherwise be able to receive it. But are there other aspects of this care delivery method that we should consider or be aware of?
Yeah, I think the telehealth or telemedicine option is a great resource for these communities. If it's available, I think being able to call a healthcare provider and receive feedback on whether they should be coming into a clinic for further assessment or if it's something that can be handled from a distance. The more we can keep patients at home or the people in their community, the better we are as far as preventing or slowing that curve to keep the number of COVID cases from rising so quickly, especially with the more people we have coming into clinic. If we're not aware of their exposure, then often people are being tested after the fact, and it goes back and increases all of those people who are exposed unknowingly. It increases their risk. So having the opportunity to be able to care for these patients through a teletype service allows for these patients not only to cut down their risk of being exposed, but also just to seek care, maybe for something completely unrelated or continuity of care. I also think it offers these people the opportunity to reach out that maybe they wouldn't have done prior to COVID coming about, and showing that there are resources there and people want to help them.
Do you see in the rural communities, telemedicine may not be as well known, or the technology? Are you finding that patients are trying to use this technology, adapt to this technology to keep themselves safe? And especially as we're hearing more about sheltering in place, I know people are questioning is it okay if I go to the doctor for an appointment, or, I may not be exhibiting symptoms specifically, but I do need to go to my doctor, but I don't know if that's really allowed. So is the telemedicine allowing that, and are people able to embrace this technology, perhaps being in a more rural surrounding?
Right. And I think looking at the telemedicine aspect of it is, when we think of traditional telemedicine, we have a nurse or a trained professional going into someone's home with the equipment and then being able to virtually show what's being examined back to the person at a different location. And the provider then being able to provide a medical diagnosis and treatment plan based on what they're physically seeing. But what we're seeing right now is not so much of people going into homes, but it's more of these providers carrying on this conversation over the telephone, also being able to do more of a face-to-face virtual session. There are a lot of different applications that have been used to make this an option where people who have smartphones or computers to be able to log into a session and see their provider that way. So when I think of telemedicine right now, what's happening is it's not the traditional telemedicine where you have someone going into the home, but it's more of a virtual care. I do see that people are using that if they know about it. I think this is something that's put back on the community, and being able to know, are these healthcare providers in the community reaching out and letting their patients know that this is an option. Personally, the clinic that we have called patients, especially patients that were concerned, maybe they were supposed to come in for a follow-up, just to let them know, hey, the clinic isn't open right now to have patients come in. Here's our number if you need us, if you're having any problems, call and let us know. If it's something we can handle from a distance, we want to do that. Also, not necessarily concerned about treating the virus or symptoms related to that, but also being able to offer the opportunity for patients to get their refills and normal continuity of care without having to come out to the clinic at that point. But I do think the burden of this definitely falls onto the healthcare provider offices and being able to let their patients know about this. In rural areas, often people aren't checking social media. So, sometimes it may be just that provider's office picking up the telephone and calling to check on their patients. And I think that making that communication, that's going to be a big key in it, is people reaching out and knowing who to call when they do need help.
So just keeping the lines of communication open is crucial, and especially during a time like this.
It definitely is. And like I said, I don't think it's necessarily just specific to COVID. I think it's just keeping that communication open, regardless of what the person in the community needs.
In talking about the patients and the patient population, the South has an increased prevalence of diabetes and other conditions that can put patients at higher risk during this pandemic time. And with this in mind, are there unique challenges and things to consider when caring for this patient population?
I think you've reached or touched on it about communication, having good communication with the patients, letting them know, risk, signs and symptoms to be aware of, and having that patient-provider relationship to know the patients that really need to be educated on it. Also think when the providers are speaking with the patients, to have just a general screening available to ask them specific questions to rule out concerns of the virus, risk of the virus. But one thing I think we're seeing a lot with the rural communities and small towns is these patients, or the population, they're practicing social distancing more easily because they are more rural, so they're not exposed to all the urban environment quite as easily as the urban areas. But with that, also recognizing they do have a lot of comorbidities that do put them at higher risk. Again, I think this is where education and communication are key to helping keep the community healthy and safe.
As we are talking about telemedicine, one question that came to mind is, do you see that this will be something, a trend that continues once this COVID-19 crisis subsides and healthcare and medicine delivery return to some semblance of normalcy?
That's a great question. A year ago, we were seeing where insurance companies and I think of like Medicare being a prime example of where telemedicine and telehealth was starting to be more accepted and more of a common thing that was going to be allowed and reimbursed, which helps with running clinics because because providers want to be able to be reimbursed for their services. So that was something that we were seeing slow to change, but the change was occurring. So now with this coming across and seeing some of the large third-party payers and making this something that's openly billable and reimbursed to providers, I think that it's something that they're going to see that if we can capture the data on the positive impact this has had, especially in our rural communities, small towns. I think the numbers could support this being able to continue on. I think it's going to be someone being able to take that data and show how telehealth and telemedicine allowed for improved healthcare. And if the improved healthcare is there, ideally these payers will continue to support that to continue on. I definitely see from my perspective, the ability to provide care for my patients, whether they can get into the clinic or not, has been a great resource for taking care of them during this time. And I would love to be able to offer that continually after this virus has settled down and things return to the new normal.
It also sounds like as patients see that they can still receive care, they may, especially in a time like this when everyone is resources are limited, people don't want to get out, they're being told not to get out. It sounds like this could also be an incentive for them to patient empowerment to take charge of their health care. So it seems that that would be another benefit of the telemedicine component of all of this.
So I agree. I think it offers, right now during this time of the new term social distancing, I think it offers people who are typically kind of they're homebound or they're not out and about in a community all the time around a lot of public places. This offers them that opportunity to communicate with the outside world more so than they typically would. And I think that it will hopefully open up that continued communication and continued need and desire to help improve their health care. I also think if they have this opportunity to be able to do this almost at their own convenience, what a great way to be able to work around someone's work shift or their home life and be able to provide them health care at their convenience. And still be able to offer the same service that you would if they were coming into the clinic. So I think that there's a lot of benefits that are coming with this, and I'm hopeful that the numbers, again, I think that if we can get the statistics and be able to show the improvement in care, that this will be supported.
COVID-19 has had a lasting effect on all aspects of our lives, and we will see this for a very, very long time to come. How do you feel that this pandemic has changed, impacted rural health forever, really? What do you see changing or being different in the way care is delivered?
Currently, I feel like we are so new to all of it that we really can't even grasp the change or impact it's going to have quite yet. I think that it's going to be something where we see the immediate impact of the smaller communities. Businesses are closing due to recommendations for non-essential businesses to close their doors for a short amount of time or for, I guess, really an indefinite amount of time. And I think this is something across different states, the impact that they're seeing. I think it's going to be something that has a long-lasting impact. I honestly, at this point, I don't know what to say in regards to what it's going to look like in the end. I know right now that the communities seem to be working together and standing together and really trying to help support one another. But I think that's something, the long-term effects, we're going to have to wait and see what happens. We really don't know where or when it's going to end and what the end is going to look like to know how to pick up the pieces and move from there. And I do feel like it's opened our eyes to being more prepared. thankfully, with the digital age, we have technology readily available where we are able to do the face-to-face type virtual meetings with patients and communities and businesses. So that's definitely helped. I think now we can start planning for if this were to occur again. But as you said, this is something that's never occurred in most of our lifetimes. We think back to the Spanish flu that occurred in the early 1900s. That had a lasting impact, and I think that they didn't really see the overall impact of it for several months after, and it's kind of just waiting to see what happens from here.
It is, and I think right now everyone is just trying to live in the moment and take care. I mean, everything seems to be coming at us so quickly, and it's changing day by day. So it certainly does remain to be seen what's going to happen as we struggle with the day-to-day implications. It really is kind of difficult to look a bit further down the road. What would you tell people? What would be a piece of advice you would share with listeners as it relates to rural health and COVID-19?
So from a healthcare provider standpoint, I encourage providers to stay up to date, stay current in what the CDC is releasing on guidelines of caring for patients. I encourage the public to know what's happening. What is the state health department or public health, and what information are they providing, and staying up to date on that. I think like you said, as things are changing so quickly, the more we know from reputable sources, the better we can prepare. And so that we can have a plan of, we may not know what next month looks like, but we know what right now looks like, and trying to make decisions based on good resources and good reputable information. And I also think just keeping those lines of communication and being flexible, and knowing that sometimes providers aren't going to have all the answers, or resources aren't going to be able to provide specific details up to date on the minute, but knowing that information is coming and people are working diligently. You see it all over the US and across the world, just working hard, trying to come up with ways to help lessen the impact, help take care of the people who are currently sick, and help prevent more people from getting sick.
Thank you so much for taking some time to join us today. This has been a very enlightening and informative conversation as we look at how rural health is still able to be connected with medicine and healthcare, especially in a time right now when things are so uncertain, and everyone is experiencing just limited access to care just across the populations. And so again, thank you very much for joining us today and sharing your perspective and your insight.
All right, thank you for having me.
Thank you again for joining us. To subscribe to additional SMA podcasts, please visit sma.org/podcasts.